Hello, my name is R.J. Heyman. I'm the Senior Associate Rector at St. Martin's Episcopal Church for Christian Education, Stewardship, and Student Ministries. Welcome to my mess of an office. I'm sure that you can relate to this. First of all, thank you for taking the time to click on the link from the email that you got and even begin to watch this video, which is probably going to last about 15 or so minutes. But what I want to do today is make a rationale or kind of motivate you to continue to watch this video and speak a little bit out of my own personal experience. If you're anything like me, like I said, you probably have a desk that's a little bit messy. You have way too much to do and way too little time to do it between Sunday worship services and hospital visitations and sermon preparation and email answering and fundraising and whatever else it might be. Also, if you're like me, you are probably, highly educated. That sounds weird to say, but, I have a bachelor's in arts from the University of California at Berkeley and a master's in divinity from Trinity Episcopal School for Ministry. And so you have a lot of education, you've been well trained, you have a lot of experience, and you're very good at what you do. And yet, if you're like me, you also have a lot of people who are coming to you with issues that you may not be equipped to handle. You may not be trained to handle. People coming in with addiction issues, depression, anxiety, children who are out of control, all sorts of things. And they come in and you want to help and you want to listen and you see them, 1, 2, 3 times. But at the end of the day, you know that even though you have been trained to be a minister, to be a leader in God's church, you are not trained to deal with those kinds of issues. And so what we would like to do today is spend just 15 or 20 minutes not equipping you to handle these kind of issues, but rather to see them, to diagnose them, to assess them, and then to refer them out. We want to connect you. The Hope and Healing Center and Institute wants to connect you with a wider group of professionals in the Houston area and really across the nation who can help you with these issues, which may just be a little bit more than you can handle. Because like I said, I know the reason you got into this work is because you love God and you love people and you want to see God's healing hands at work in the lives of people, and yet there are certain areas that you're just not equipped to handle. So I hope you'll take the next 15 or 20 minutes. I think it'll be well worth it, and the hope is that even though you may not feel like you have the time to do it right now, it will free up a lot more time in the coming weeks, months, and years. So thanks again.
I'm John Burris. I'm a psychiatrist. I have been working in public settings and academic settings for almost 20 years. My current job is as the head of psychiatric services for the county in all of Dallas County, Texas. Mental illness is common. Mental illness is present in almost all settings and all families, at least as far as someone we know or someone we're familiar with. And oftentimes it shows up in our offices or in our living rooms when we didn't ask for it and don't expect it. It's just part of being involved with people. The major conditions that you're going to find that'll arise in a faith community, depression is absolutely common, very, very prevalent in the community. So you're going to see, you will have people in your congregation with depression. There's also, in addition to that, some other kinds of mood disorders like bipolar disorder, which in addition to the depression has some fairly profound high periods where people get out of hand to some degree when they have what's called a mania. I think as the leader of any parish, the first way to gain entry into that conversation is to say, gosh, I'm worried. I've seen these things, I've seen this, that, and those are troublesome, and they often can be the sign of a more persistent mental illness in some cases. Can we talk? Can we talk about what's been going on and how these things came about and what we might be able to do to get you pointed in the right direction? But broaching it with that first, I care and I'm worried. is often the best way to get the conversation started. It'd be a great idea for people at the head of faith communities to have a small Rolodex or even a large Rolodex of available resources in the community, so that when these instances arise, you already have something to be able to offer as a help. People don't often need an ambulance or an immediate intervention, but they really need a phone number. They really need a referral. They really need to know that there's somebody out there who there's some experience with and they can trust that they're going to get the help they need. Treatment for mental illness can look like any number of things or all things put together into a package. So common components, medication may be a piece of the treatment. Medication in the last several decades has become very easy to tolerate and very effective. Therapy and all different kinds of therapy, whether it be individual, meaning one-on-one, or group therapy, might be a big part of the treatment and the outcome. There are other kinds of rehabilitative programs that are important when somebody has a severe mental illness, and that could be a part of the whole package of treatment that comes for the patient. So in any parish, any pastoral community at all, I think there are several critical pieces of intervention that need to be in the toolbox, in the toolkit of the parish leader. One, don't be afraid to ask. You got to ask. You got to find ways. Think of a script. Think of the different ways to broach the subject, because it's a delicate subject, but it needs to be asked. Two, if somebody says, yes, I am struggling, you got to know what to do next. So you got to have some resources. You got to have some ideas. What am I going to do when they say, yeah, I actually have been thinking about killing myself? Then you got to have some thoughts on, I've got resources, I've got options, I've got something to do next. Three, be ready to offer support, because that's often as helpful as anything. The professional piece will come from the professionals as far as the medical treatment. But there's a lot of family and pastoral support that are critical to these kinds of situations, because this is transforming somebody's life. This is a pivotal moment in everything that's going to ever happen for them. So it's very important to be there and be ready to provide that kind of support.
My name is Father Bill Wigmore, and I'm with the Hope and Healing Center here in Houston, Texas. I'm also head of Recovery Ministries for the Episcopal Diocese of Texas. Part of my personal story is that I've been in recovery myself almost 42 years. My whole family has been affected by addiction. Every male member of my family either died from this illness or wish they had, sadly. And I got sober really somewhat providentially, I would say. I was in a seminary in Detroit, Michigan many years ago. And as a part of that process, I volunteered at an alcohol and drug treatment center. And that was where I learned about addiction and how it affects people. And in my family, the definition of addiction was you can't hold a job. As long as you were holding a job, you were not an addict. But I learned something different there, and that's the purpose of this video, is to help people learn some of the signs and symptoms. That saved me personally, and it saved my 3 children from going through all the pains of addiction. Some of the signs and symptoms of this illness are going to include loss of control. When an individual begins drinking, their intention ordinarily is not to get drunk, but once they start the process, they cannot seem to stop. So they drink or they drug more than they had intended to drink or drug. There's signs of withdrawal, that when you're coming off of alcohol or drugs, the body is detoxifying in effect. And so it's demanding that, where is my drug? Please, give me more of this thing. And it can be a very serious medical condition that's involved in the process. The inability to stop in spite of serious and growing consequences. I mean, to me, that's one of the major differences in this illness. If someone else is having problems, they look at those problems and they say, hey, I really need to put this stuff down. The alcoholic, the addict, the person who's dependent is unable to do that. And that is one of the signs of having crossed over into becoming an addict oneself. And of course, the major symptom is denial. this is unlike any other illness in the fact that the person who has the illness is going to be denying that they've got it. If you've got pneumonia, if you've got heart disease, you say, I'm going to get help. Who do I go to see? You get alcoholism, you get drug addiction. We go underground, and the person is not going to be seeking help. Of course, one of the great myths of this illness is that you can't help an alcoholic or an addict until they ask for help, and that simply isn't true. What we know now is there's an intervention process, that people have an opportunity to intervene in this illness. The earlier they do that, the better the results are going to be. And nobody is in a better position, perhaps, than clergy. Clergy are visiting with both the individual, with the family, and oftentimes they're in relationship with the kids as well. And signs and symptoms are going to be appearing amongst all three of those populations. You know, this disease is mental and it's physical, but the recovery process, by and large, is spiritual. You can't underestimate the power of spirituality when it comes to recovering from alcohol, from drugs, and from other addictions as well. And this is one of the reasons that clergy can play such an important role in this process. All of the denial, all of the lies, the cheating, the falseness, the shame, it's got to be broken through. And people have to learn that it is an illness and it responds to treatment. So the more that clergy understand this illness, how it affects families, the better prepared they're going to be to provide them, to direct them to the help that they need.
Well, I'm a licensed marriage and family therapist and a licensed professional counselor, and I'm the executive director for Archway Academy, which is a sober recovery high school here in Houston, Texas. You know, it's interesting, over the past 10 years, I think things have shifted quite a bit. And we're, especially with the introduction of prescription drug abuse, so many things are changing when it comes to availability of drugs and alcohol to young people, and also social perception of drugs and alcohol, especially with legalization of marijuana happening in multiple states now. So what you knew 10 years ago doesn't necessarily apply now. And then you put on top of that all of the new challenges that come with social media and how that's impacting perception of young people, and how that's impacting choices, and how that's impacting their experience of what fun looks like or what normal looks like. So there's a lot of contributing factors that are putting increased pressure on our young people to use drugs, to self-medicate with drugs and alcohol, and to also attempt to fit in this day and age. There are a lot of alternatives for help. You know, the best starting place is to receive a formal assessment by a mental health professional or an addiction specialist. That will really help the family to know, are there other mental health issues that are going to possibly impact what treatment will look like for this young person that need to be addressed? Because there are kind of two paths that we see young people with substance use issues. The one path is they end up using drugs and alcohol because it's fun, and a lot of people are doing it. There's not deep-seated trauma, they're not self-medicating. It's really about having fun. It's really about social engagement. It's about doing what other people are doing. It's about letting loose and having a good time. Then there's the other path, which are for some of our kids that are medicating a mental health issue. Maybe they've got kind of debilitating anxiety at school. Maybe they've experienced some bullying, and so there's some social trauma that's happening. Maybe there are things that have happened in the family. Maybe there have been deaths of grandparents or of family members. Maybe there's been a divorce or a separation in the family. And so the kids may be using to kind of numb out those uncomfortable feelings they're experiencing. And I say this a lot to clergy as well. It is very appropriate for you to sit down with a young person, very caringly look them in the eye and say, I'm concerned. And I'm curious, are you using drugs? Are you abusing alcohol? I need to know in order for me to help you. They say now that children, young teens, spend more time taking and retaking selfies to put on their social media than they do working on their homework. mean, that's just crazy to me. What kind of persona they want to put out there. And what's really refreshing for young people is when they sit down with someone who just wants to know who they are, who wants to connect with them, who has the kind of presence and demeanor that says, you can tell me anything and it's going to be okay. I'll hold your hand through whatever process this is going to be for you. Lecturing is not helpful. Quoting a bunch of statistics to them is not helpful. Telling them to do internet research on different ways to just say no is not helpful. But telling them, that must be really hard. You know, let's get your family in here. Let's really sit down to discuss what you have on your plate. It sounds like you have a lot on your plate. Let's talk about how we're going to get you the help that you need. A lot of listening is required when dealing with adolescents. Parents need a place to be able to go, to be able to vent, to be able to say, this is not working for me, who has ideas. A place to go to feel safe, to say, help me.
So in conclusion, we firmly believe that this video will equip you with the tools that you need to be the most effective pastoral care presence you can be for your people. And honestly, it will give you peace. It'll help you to sleep better at night, knowing that this congregation, these people that God has entrusted to your care, that you have put them in the best possible hands, that you've taken them to a place where they can find the healing, the hope, that you may not be equipped to provide them with. So thanks again for watching this video, and we hope that it's helpful. And again, we thank you for taking the time.